I'm Dr. Alok Sharma. I'm basically a neurosurgeon, that's a brain and spine surgeon, and I specialize in something called stem cell therapy. Now, we all have heard of stem cell therapy, but what exactly is stem cell therapy? So, stem cell therapy is sort of like the new kid on the block in the medical treatment world. Up to now, the only treatments we had, either we had medicines, like we have tablets or injections, or we had surgery. We went and cut and sutured and removed. But now we have a new treatment. It's neither a drug nor is it surgery. It's a form of treatment where we use healthy cells to repair damaged cells. So this is what stem cell therapy is about. It is a cellular therapy. It's a biological therapy. How we do it is like we take a needle, we put it into the bone just above the hip bone, into the pelvis, and take out the liquid in the bone, which is called bone marrow. We all have heard this word, bone marrow. What exactly is bone marrow? Bone marrow is the liquid which is inside the bone. This is the place where our body's blood is produced. And in this bone marrow, there are these cells called stem cells, and there are literally millions of them. So when we get bone marrow out, along with the bone marrow, we get several million stem cells. We take this bone marrow to our laboratory, and in the laboratory, we sort of filter it or purify it and isolate the stem cells and throw away the rest. And once we have these stem cells, we now inject them into the lower back. Why in the lower back? Because in the lower back, there is a fluid called cerebrospinal fluid. And when we inject into this fluid, the cerebrospinal fluid takes these stem cells all the way up into the brain and all over the spine and nerves. So where can we use stem cell therapy? Now, there are several conditions for which there were no medical treatments available. Now, in children, these included autism, which is a childhood neurodevelopmental disorder, in which the children have behavioral issues. They can't speak. They aren't able to, interact socially. They can't go to normal schools because they can't read and write. They are very hyperactive and sometimes get aggressive. These are the symptoms of autism. Autism is getting, it's increasing in its incidence year by year. There was a time, say 10 years ago, when 1 in 160 children had this, but now today 1 in 60 children have autism. So it's a 3 times increase in 10 years. There are several other conditions like cerebral palsy, where the brain is damaged at the time of birth and the children have stiffness and tightness of the legs, or intellectual disability that earlier was referred to as mental retardation. Now we call it intellectual disability, where their minds are slower and their IQ and their attention, concentration, memory is affected. It also helps in a disease called muscular dystrophy, where the muscles start gradually shrinking, and in a particular type called Duchenne muscular dystrophy, actually all the boys, they die by the time they are 25. So all these conditions, autism, cerebral palsy, intellectual disability, muscular dystrophy, there are no treatments available. There are no medicines, there are no drugs that can cure this, nor is there any surgery. But with stem cell therapy, we are able to actually repair the damage in these kids' brains and give them a new hope of life. So today I'm going to focus this little address to you on autism. Now, like I explained to you, in autistic kids, they look normal. You look at them and they seem normal. But because they can't talk, because they can't communicate, because their higher functions are slower, they aren't able to integrate into normal society. They get aggressive, they sometimes injure themselves, they hurt others. And autism is not something which affects only the child. The whole family gets affected. Because when you have a special needs child, it affects everyone in the family. Up to now, the only treatments for this was rehabilitation, like occupational therapy, speech therapy, psychological therapy, etc. There were some drugs which helped to reduce the hyperactivity and give symptomatic relief, but nothing more was available. But now with stem cell therapy, we can actually almost completely nearly get these kids to lead normal, independent lives. We've done a lot of research on this, and we do these special scans called PET scans. And in these PET scans, we see these areas that are demarcated as blue as the areas which are hypometabolic or low functioning or weaker. And we have found that these areas of the brain which are functioning less are the cause of all the symptoms of autism. Now, with stem cell therapy, we've seen that after we give stem cell therapy, within 6 months, almost all this blue starts clearing up. and which basically means that the brain, which is functioning less, has now started healing, has started repairing, and we are able to give these children a brain that is as close to normal functioning as is possible. The beauty of stem cell therapy treatment is three. First, it's a very simple treatment. Like I described to you earlier, we put a needle into the bone marrow, take out the bone marrow, and with one needle, inject it into the spinal fluid. So the whole treatment involves only 2 injections, where with one we take out, with one we put. We are taking the child's own cells from one area where they are extra and putting it back into an area where it is less. It's a very, very safe treatment, and we have treated now more than 1,400 children with autism. Actually, we've treated more than 7,500 patients overall of all the diseases, but autism itself is 1,400, and we have found that there are no major irreversible side effects, deterioration because of the stem cells per se. So it's a very, very safe treatment. So I can assure you safety of this treatment, which means nothing will go wrong with the child. The child is not going to get worse in any way. And the treatments are definitive. But the thing is that we have to do this treatment early. What we have found is when we do this before 12 years, we can have kids who become almost completely near normal. The word we use is neurotypical. Those who are between 12 and 20, well, they improve, but we will not be able to get them to be, neurotypical or near normal. Some symptoms remain, but they improve quite a bit. And the older the children get, the less are the improvements. So the message is early intervention. Okay, as soon as the child is diagnosed or we see the symptoms, and after trying all the rehabilitation, if there is no significant improvement, stem cell therapy is definitely an option worth thinking of. Many of us know, we have family, friends, relatives, neighbors who have a child with special needs like autism or cerebral palsy or intellectual disability. And this is a message that needs to go out to them because they've been told all these years that nothing can be done for the children. But what I want you to know is we can today definitely help these children and give them an opportunity, an option to be able to lead independent, close to near normal life. A very important part of the work done at the NeuroGen Brain and Spine Institute is that all our work is published in scientific journals. We have a total of 86 scientific papers. 14 of these papers are on the role of stem cell therapy in autism itself. We also have written chapters in international textbooks, and we have published 14 books of our own. So the work done at the NeuroGen Brain and Spine Institute has a very solid scientific foundation to it, and all our results are in the public domain. Thank you for your attention. This is Dr. Alok Sharma from the NeuroGen Brain and Spine Institute, which is located in Navi Mumbai.